I talk about diabetes a lot, and there's a reason for that. 1 in 2 Americans either have prediabetes or diabetes. And the problem is that a lot of people don't fully understand or recognize the risks that have gotten them there. And even though people are on a lot of medications for their blood sugar, they don't fully understand that some of these medications are helpful for not only your blood sugar, but also your weight and your heart and your kidneys. And so in this video, I'm going to dive specifically into semaglutide, which everybody knows and understands as Ozempic and has been used and widely recognized as a weight loss medication, but it also goes by the names Rybelsus and Wegovy. And this medication does so much more for you than you could even imagine in terms of diabetes management. My name is Takova. I'm a board certified ambulatory care pharmacist, and I'm here to help these medications make a little more sense for you. And as I mentioned in today's video, we're going to talk about semaglutide. So let's dive into it. I want to start with talking about what this medication is for. So I already mentioned that it goes by 3 different names: Rybelsus, Ozempic, and Wegovy. Rybelsus, I'll start there because that may be the one you're least familiar with. It is the oral or taken by mouth version of semaglutide. Then we have Wegovy, which is primarily indicated for weight loss, also semaglutide. And then we have Ozempic, which is the original, and it was approved for type 2 diabetes. And again, it is also semaglutide. All of these medications have similar benefits, although they are under different brand names. And so they are indicated technically for different. Next, I want to talk about how this medication works. And so I know you all know that it helps you lose weight. If you're taking the medication, you probably realize that you get full quicker, but do you understand the science behind that? And I'm not going to get too deep into it. I could talk more about that later, but let me just give you the nitty gritty details. So we have lots of hormones in our bodies. 2 of them are GLP-1 and GIP. We'll talk about GIP in a different video with like Mounjaro, for example. But focusing on GLP-1, so when we eat, our bodies automatically release GLP-1 in response to that food. That hormone GLP-1 then goes to a multitude of places, but primarily to the liver and the pancreas. And so when it goes to the pancreas, it asks the pancreas to release insulin to help cover for that meal that you just ate. And I'll talk about the role of insulin in a different video. When it goes to the liver, it tells the liver to stop making glucagon or to stop converting glucagon into glucose. So normally, if our blood sugar gets a little bit low, our liver is there to support us, and it synthesizes or makes glucagon and turns that into glucose so that we can use it for energy. And so when we eat and GLP-1 is around, we have no need really for the liver to be making more sugar for us because we've already consumed enough. So in short, GLP-1, the hormone, does 2 things. Tells the liver not to make more sugar, tells the pancreas to give us more insulin to cover for our meal. Now, the problem is in individuals who have diabetes or who may be overweight, there may be an imbalance or a deficiency in GLP-1. And so that's where the medication comes in. So medications like semaglutide are actually copycat versions. They mimic the natural hormone GLP-1. And when you take them, they go to the pancreas, tell the pancreas to give you insulin, tell the liver not to make sugar. And those are good things. We need that. And so that way we can just give our bodies what we are not making enough of or what we're not using appropriately. Now, I want to talk a little bit about side effects. I know that there are a lot of things out there in the news that talk about these long-term effects of Ozempic or semaglutide or whatever brand version that someone is using. And I really just want to focus on the basics here. So one of the big side effects is nausea. So as this medication is allowing you to release more insulin, slowing down your sugar production naturally, it's also slowing down your gastric motility or the digestion of your gut. And so that may make individuals feel a little more nauseated, especially if originally or initially you're still trying to eat the same amount of food that you were before. That leads me to the next side effect, which is increased fullness. And so you may find that you don't want to eat much more food. And so that is just kind of mechanistically how this medication can be helpful for you. In addition to that nausea, you may have some constipation, again, just because everything's moving slowly. And you may have some fatigue, and that could be because you're not able to use that sugar for as much energy as you would have, or you're not eating as much at baseline. So now I want to share a few just pharmacy pearls related to this medication. Number one, first and foremost, it is not insulin. And so I think most people know that now, but in case you don't, I want to make that clear. Insulin is also a hormone, but it is not this hormone. Semaglutide is specifically GLP-1, which does allow our bodies to release more insulin, but it is not insulin. So I don't want individuals to think that. The next thing is that if you're taking this and you already know that you have a risk of nausea, go ahead and start off with reducing the size of your meals. So eat smaller meals, and that may help with the nausea. The nausea should also subside after about a dose or two or a week or so of taking the medication. If it doesn't, then your physician can just bump you down to the next dose if you've already been bumped up, or try you on a different agent. The big pharmacy pearl that I want to mention is something that I kind of talked about at the beginning of this video, which is that these medications are doing so much more for you than you can imagine. When someone has type 2 diabetes specifically, they are at a 15% higher risk of dealing with things like a heart attack. And so this medication has been shown to reduce the risk of a heart attack as well as slow the progression to kidney disease. Because also, if someone has diabetes, they're at a higher risk of having kidney disease later in life. And finally, just some real life tips. I already mentioned that you should eat smaller meals, but also consider starting with your protein first. And that may also help with just overall unwell feeling that you might get from this medication. Chew slowly so that you're helping with that digestive process in the mouth rather than making your gut do all the work. And finally, if you already have digestive issues because you have some other medical condition or you're constipated, you need more fiber, you need pre and probiotics, whatever your case may be, if you're already not digesting things very well, this may not be a good medication for you. It's also important to note here that individuals who do have diabetes, oftentimes, if it's poorly controlled specifically, but oftentimes they are digesting slower as the disease progresses, which is a natural thing with diabetes. And so, if you're someone who is later stage diabetes, then this medication may not be good for you if you are already having slow gut motility or slow digestion. Okay, I could say a lot more about semaglutide as well as its cousins, tirzepatide and dulaglutide, but I won't get into those in this video today. If you would like to hear about those, please let me know in the comment section below. If you have some specific questions that you feel like I could answer in a longer or even a short video, let me know. This video is just meant to introduce this medication, give you some 5 key areas of things that I feel that you should understand a little bit better if you are taking this medication. But I'd love to hear your thoughts. If you learned something new or if I reinforced something for you in this video, do me a favor, hit the like button, consider subscribing to my channel as I get this thing going and start to post more videos about quick tips about medications as well as some longer videos going through why we treat certain conditions with certain medication in a certain order and anything else that you want to hear. So thank you for watching to the end and see you next video.